Hi, my name is Dr. Andrea Ellis here at Meadows Chiropractic in Dallas, Texas. And today I want to talk to you about the Webster Technique. So I am an ICPA member, which stands for International Chiropractic Pediatric Association. And that association was started by Dr. Larry Webster back in 1986. Dr. Larry Webster co-created the Webster Technique with Dr. Jeannie Ohm. And I learned the Webster Technique from Dr. Jeannie Ohm back when I was a student 15 years ago. So what the Webster Technique is, it's a two-part technique. It's one, a sacrum adjustment, and two, a round ligament soft tissue work. So why do we do that? So if you can see the uterus in the woman's abdomen, it is anchored to the spine, to the sacrum, through that uterosacral ligament. That's a big ligament, and it's holding on to that uterus. And then it also is attached laterally, one on each side, by the round ligament. Now, the round ligament is the only ligament in the entire body that has muscular tissue in it because it has to stretch. As that uterus gets larger and larger, as that baby grows and grows, it's got to stretch or that baby won't go anywhere. So that can create some issues. So if you can imagine that sacrum, if it's not in alignment, and so I'll describe to you how that sacrum moves. So if you can imagine this being the sacrum, it's kind of a flat-ish bone. It's between the two pelvic bones, but it also has the entire spine sitting on top of it. So it moves a few different ways. It moves right and left, but if you can imagine a pin coming through the middle of that sacral bone, if it's tilted to the left, that means if it's facing to the left slightly, you're going to have the left side of that sacrum tilted back, and you're going to have that right side of that sacrum tilted forward. Opposite side true. If it's tilted to the right, you're going to have that left side forward and that right side back. So when it's out of alignment, if you can imagine that uterus being anchored down to that sacrum, if it's tilted to the left, you're going to get some torsion to the left of the uterus. And now if you can imagine if it's going left, that right side round ligament is being pulled on and it hurts. So if it's tilted to the left, what we do is we adjust that left sacrum and we adjust that, or we work on that right round ligament. And those two things together create the Webster Technique. So why do we do that? Well, it hurts. Number one, that sacrum, if it's tilted one way and if that round ligament's pulling, creates pain. Sacral pain, pelvic pain is a really prominent pain for my pregnant patients for good reason, but also that lower abdominal pain, that shooting. Sometimes it feels like stabbing. Sometimes I feel like electricity pain. Sometimes it shoots down into the groin or into the legs, and that hurts. But also, if that uterus is torqued one way or another, it is just a giant band of muscles. And so that baby may not be sitting right because it can't move into its proper position. So when you take the torque out of that uterus, having it sit flush with the pelvis, that allows the baby who may be malpositioned, if it's frank breech or full breech, to be tilted head down. So it helps with that as well. So I hope that answered some questions. If you are pregnant, if you are having sacral pain, if you are having round ligament pain, any pain really, or looking to get a baby in a better position, you can call our office at 214-987-9973, or you can get our website at meadowschiropractic.net, and we have a button so you can make your new patient appointment, and we'd be happy to see you. Y'all have a great day. Thank you so much.